hosting Navigating Health Insurance in a Seasonal Industry. So we have Carrie Soulliere here with Covered with Carrie. She's going to host us today and be our presenter, share her information. Huge thank you to you, Carrie. We appreciate you making the time and the effort to put this together and do this for our members. I also want to shout out to our members. Thank you so much for membership, for your continued support, for your donations, sponsorships. That's why we can do the work we're doing. That's why we can be here putting on webinars. So we appreciate you. We appreciate your continued membership and support. Sponsors, same to you. Thank you for your donations and participation and commitment. Couple of quick announcements before we get started. We do have 2 more webinars coming up in this fall season. October 3rd, that's a Thursday, same time, Thursday, October 3rd, how to use AI to boost search rankings on Google. That is going to be presented by Paul from Outfitter Marketing Pros. Paul does a really good job of working with outfitter-specific businesses. He came from the outfitting business. He's a marketing professional. Really, really good things to say, and he's really good with AI. So that should be a great webinar to catch as well. Then the week after that, October 10th, which is also a Thursday, we'll have Maureen from Cornerstone Safety Group. Cornerstone is one of our partners, so we partner with them throughout the year. They provide a lot of safety resources for us. They're available if members need them or if we need them for anything. So they're a great partner in this industry. She is presenting safeguarding mental health and outdoor recreation, and she is presenting strategies for outdoor professionals. So very specific to us and mental health. So you'll want to catch that one too. Maureen's really, really great. So hopefully you'll be there. Last but not least, my favorite thing, we are about 75 days away from our annual conference and Outfitter Expo. We will be in Chattanooga, Tennessee, which America Outdoors considers to be really their home. Like our roots are in Tennessee. Going back to the Ocoee is super sentimental. We will be running the Ocoee on Saturday. Tennessee Valley Authority is turning on the water for us specifically. And the conference has a great lineup. So check out our website. The agenda's up, the schedule's up, the pricing's up, everything's there. We would love to see you there. We hope to see you there. Recordings are available if you can't be. But please check that out. We hope to see you in person there. With that being said, I'm about to pass this over to Carrie to start, but I want to remind you that this is really about you and what you can get out of it. So please bring your questions. Feel free to raise your hand. Feel free to turn on your mic and ask questions if you need to. Type questions in the chat. I'll monitor that. Carrie's going to check out some of that too. So between the two of us, we'll catch all your questions. But we want to make sure that you're getting out of this what you need. So Carrie would love to take questions anytime, anyhow. So bring them on. With that, Carrie, thanks for being here. I'm going to turn it over to you, but I will be here if you need me.
Thanks so much for having me, Karen, and I really appreciate America Outdoors being so supportive throughout the entire growth of my agency, serving the outdoor recreation industry. You guys have been super awesome through the whole thing, and I really appreciate you inviting me to be here.
So, can you see those results? Or not yet? The polls and quizzes. Everyone answered those questions.
It shows me they were answered, but it does not show me the answers.
Okay. We'll look at them later, unless you want to.
Yeah. I mean, what was the overall results of where is everyone from?
So everyone is from a different state. Actually, I have 2 Californias, but other than that, everybody's Ohio, Pennsylvania, Florida, Illinois, Arizona, South Carolina, North Carolina. We have day rafting, we have backpacking and hiking, whitewater rafting, biking, rafting. We have a guest ranch, river trips, campgrounds, canoes, rafts, rentals, Grand Canyon Youth, welcome, and outdoor ocean kayaks. So lots of variety.
Have a nice mix there, all sorts of states. I did not hear a state that my agency is not able to help that in, so that I'm able to help everybody here. So that is awesome. That's a great way to get started. And thanks for joining me, guys.
Great. Okay.
Yeah. So we'll go ahead and get started. I got a presentation started for us. So I'm going to go ahead and share that. And then I'll go ahead and get it back into presentation mode. So there we go. All right. So we're talking about navigating health insurance in a seasonal industry. My name is Carrie Soulliere, and I own Covered with Carrie, which is an insurance agency that helps people under the age of 65 that work in outdoor recreation. Everybody knows that this is a very complex industry. Most employees are part-time. They work for you for a certain period of time, and then they go to the next job. So it makes it offering health insurance very complicated and something that's sometimes not feasible, but we found solutions so that you're able to at least offer the option of health insurance to all employees, whether you're offering it as a group plan or just giving them a source of information that they can go get help enrolling in marketplace coverage. So this is just kind of overall the topics that we're going to be talking about today. A little bit about my agency, about myself, marketplace coverage, group health plan, the solutions for business owners or high earners in the industry, which are very often different than buying insurance through marketplace, and then how to contact us. So a little bit about my agency, everything printed on the screen. We've been open for about 2.5 years, and I am the primary owner and the operator. We specialize in helping people that work in the outdoor industry obtain affordable health insurance. On average, people that work at the Ocoee River pay $9.41 per month. We're really a technology-focused company. I think this is really important for this industry specifically because they're so on the go. It's not like dropping a letter in the mail is something that is necessarily going to be effective in reaching a client. We focus on reaching out to them in ways that they enjoy communicating, text message, email. We utilize automation to make it easy for people to schedule time with us and communicate with us. A really good example of this, if you want to pull out your phone and see how it works, you can text my business line. I don't know if Karen, you want to be the monkey for this one, but anyone else can try it. My business line is 304-507-8039. Again, that's 304-507-8039. And just as an example of how we focus specifically for this industry is, I can't tell you how many times last year someone called me and they're like, hey, I'm going to the Grand Canyon tomorrow. So if you just say Grand Canyon in that text message and hit send, you'll see how our automation is specifically built for this industry and the people that work in it. So when someone texts that, Karen, I'll let you say what happens on your end, and then I'll talk about it for mine.
Okay, I just got a message back. It says, hi, thanks so much for reaching out for help with your health insurance. Please fill out this brief questionnaire, and I'll be reaching out shortly. Thanks, Carrie.
Awesome. So what it's going to do is it prompts her to fill out a form. Karen, when you click that form, what does it look like?
So it looks like your homepage from the website. It says,
yeah,
benefits package, questionnaire, name, birthday, email, phone number. It's very short and sweet, it looks like.
Yep, exactly. So it would prompt them to fill out that form so that I can get consumer information quickly, because I literally had somebody call me from the put-in at the Grand Canyon twice last year. And not only that, it's going to send me a text message in 10 minutes telling me someone said the word Grand Canyon. So it will text my personal line and be like alert with little, actually, I have one. Here. So it just like, it gives me a little, this is an emergency because they're about to leave for 30 days. And just there's many things built in that capacity. Like I have filter systems built so that everybody's tracked via river and everything like that as well. So all of the technology is custom built for the industry specifically to serve them for insurance. We are able to help via most states via multiple experienced agents. So I'm not the only agent that people speak to. I help as much as I can, but I am not the agent for everyone because not every state operates on healthcare.gov. Some have their own individual website and they require their own individual certification, and doing 10 plus certifications as one person is not always feasible. So that's a little bit about our agency. And then a little bit about me. I am a river guide and I live full time in an RV. So I'm a nomad. Right now I am in Colorado, right on the Colorado-Utah border. I've been going between the two. I'm an avid long haul hiker and also obviously a licensed insurance agent. I have 8 years of industry experience and I have multiple industry designations. I love to read and I engage in political advocacy. I belong to multiple groups in the insurance industry that are specifically designed to advocate on behalf of our consumers. I also speak on podcasts frequently and love dogs. They're like my favorite thing ever is dogs. So let's just talk about marketplace coverage. First of all, how does it work? What is it? Marketplace coverage is bought on healthcare.gov or a website specifically for that state. For example, California is Covered California. Colorado is Colorado Connect. So on and so forth. Pennsylvania is PennyMac. So how it works is it is a premium tax credit. It is based on the individual's earnings, and they must file taxes each year, and it's based on their income when they file their taxes for the year prior. As most people know, people that work in this industry are generally on a lower end of the earnings that are in entry-level positions, such as guides, restaurant workers, bus drivers, etc. So they generally qualify for low cost or no cost care. I did the math. So I did the math for 125 people at the Ocoee River in Tennessee specifically. And 8 out of 10 had a free plan, $0 per month. So that's really the level of qualification that they qualify for their tax credit. So it's income-based, it's individually owned. So this isn't something that they purchase and the employer helps them manage. It's managed between themselves, and if they use an insurance agent, the insurance agent, and then marketplace healthcare.gov. So the employer is just there to help educate them. It was established in 2010, so it's almost 15 years old now, and it's often called Obamacare. I don't call it that, but that's what people often recognize it as. Oh, sorry, guys.
Carrie, just to interrupt really quick, I threw out that question
Yeah.
and it looks like about 70% of people do not offer healthcare and about 30% do, or offer health insurance. I'm
Awesome.
sorry, not healthcare.
I mean, this is a great time to start offering it, is today. You can say that we offer ways to obtain health insurance and just provide information as easy as that. So how does it help to your employees? It gives them affordable access to health insurance at no cost to you. The next follow-up question is, how does it help you? Is employees that have health insurance are healthier and happier, which means that you have better retention, better attendance at work, all the things that are really essential. just think of all the times someone has said, I don't have health insurance and I'm sick and I don't know what to do, and they didn't know how to deal with it and they missed work. So that's just a really preventive way to make sure that your business is well staffed, is to make sure that people have health insurance to take care of matters. And then what are the benefits of marketplace insurance overall? Plans are individually owned and paid for by the employee. You don't pay for them, it's the employer. They are paid for by the employee. They are giving their banking information, their card, if their plan comes with a cost. So that's a benefit for you. You don't have to manage that, worry about it. You don't have to do payroll deductions, anything like that. It's governmentally regulated so that you know it's quality insurance. It meets the government regulations for what a plan needs to include the essential benefits. It's income-based so that you know it's affordable. Insurance until you get to a certain earning level, which is very variant dependent on state. It will not exceed 9.83% of their income. When you're lower income, it will be far less than that, but it will not exceed that up to a certain earning level. It's available regardless of health history. A lot of people are very concerned they won't qualify because they've had some sort of health issue in the past. There's no medical underwriting. There's no health questions, anything like that. You can have it regardless of your health. It's available year-round for those that qualify for special enrollment. Special enrollments include income level, moving to a state with having prior coverage, getting married, having a child, multiple things qualify for special enrollment. And the nice thing is these plans can be changed as they move states for work. That's really the big thing in this industry, is a lot of people work 2 seasonal jobs and they're in different states. So when it's time to move states, it's just a simple text or a phone call to the office of, hey, this is where I'm going. One, do I need to change my health insurance? Because sometimes the answer is no. I have people that are on the same plan year round because they have a plan that works in both areas, or they have a PPO, which is a preferred provider organization, which means you can go to any doctor and have benefits. An HMO is a health managed organization, which means it's a closed network, which means you can only go to doctors that they provide coverage for. There's no coverage. So that really depends on them, but it's just knowing that they can change their plan when they move so that they have coverage no matter where they are, not just for emergencies, but for everything else. My agency is recognized as an elite marketplace circle of champions. This means you have assisted the highest amount of consumers. This is the highest level of recognition that you can get from the Center of Medicaid Services. And that is all serving this industry specifically. So we really specialize in it. We know what consumers in this industry need. Generally, it's a very easy transaction for them because it's custom built and curated to them. On average, it takes about 15 minutes for someone to enroll in health insurance, dental, and vision. And they can just go back to their life. So it's just 15 minutes and they're done because we've really streamlined the process. So what does an average plan look like for your employee? So this is the Blue Cross Blue Shield plan of Tennessee. So this is for someone that earns under $21,500 per year. The average raft guide at the Ocoee River, according to my records, makes about $17,500, so they're pretty far below this threshold. It has $0 deductible, $1,800 max out of pocket. So a deductible is what you pay before the insurance shares cost with you. So this plan shares cost with you from the beginning. The max out of pocket is what you pay up to, and then you're done paying. $0 primary care, $0 generic drugs, $5 urgent care, $0 physical therapy, $0 mental health, and $0 chiropractic. Those are all just things that are really needed and desired by people that work in this industry overall, and that's kind of why I'm showing this as the typical plan. That's what they select. So the average monthly cost to staff is $9.17 each per month. That's just taking everybody from $0 to way above. I didn't care if they were a weekend warrior that had a full-time job. If you're a raft guide, you're included in this average of 125 people at the Ocoee River. If you click here, because I know this will be shared. And then Karen, just to confirm, can you see the other screen I'm sharing now?
Yes, you're all good.
Okay. This is just where that link will take you. You can put in your own zip code, date of birth, income of your average employee or yourself. You can add spouses and applicants to see what cost is. So this is just the link to that plan I was referencing. It took us back a page, but there it is. Okay. So you can see this plan exactly as I outlined it with the official document. And also gives you the ability to browse all the plans. So a lot of people ask, why not just go online and do this yourself, right? Why wouldn't they just do this themselves? First of all, the application is kind of hard if you're not experienced, and most people make mistakes. I would say 9 out of 10 people I help that already tried it on their own just clicked the box wrong. And that's why their insurance says it's $400 a month when it should be $0. But the other part of it is they don't always sort by, oh, this is a great plan at the top. Because when you shop on your own, it just starts showing you by lowest premium. But I know as an agent that these people qualify for a higher cost sharing reduction from the government due to their income levels. So these individuals that are at this earning level qualify for $0 plans that have higher subsidies on their deductible and max out of pocket as well. And we're very educated on the plans overall and the network so that we can find the right plan that works for them. How can I get my employees enrolled in marketplace coverage? It's super easy. So Karen is sending out a link in the chat that you can click and submit a form. That link will take you to this right here. And we'll contact you and get some information out to you that you can share with your employees so that you can give them information about getting enrolled in health insurance. So that's step 1, is just fill out the form. Step 2 is share the information. Share it during meetings and group chats, however you communicate with your staff overall, and make sure you put one by the time clock in the schedule board, because that's really where people go to get information at most outfitters. You are the most important part of making sure your staff has coverage. Overall, having your owner, your boss, your manager, the people that you trust and report to at work telling you this is a good place to go get health insurance, it's going to be low cost based on what you're earning, gives them the trust to go talk to them. We want people to have health insurance in this industry. It's just inherently important. Step 3 is just continuing to remind them. I would say most people probably need a few reminders to do something that's really not that fun in life, but it's necessary. And they think that signing up for health insurance is going to be a long and hard process. Remind them how easy it is, that it's going to be a 15-minute phone call generally. They can just get it done. Then they'll have coverage starting on the 1st of next month if they qualify. I can't remember the last time I told someone that works in the industry they didn't qualify to enroll in health insurance right now. It's just most people qualify for special enrollment in one way or another, generally due to income level. Step 4 is continue to include it in part of your futuring hiring processes. So when you're onboarding people, you're getting their hiring paperwork. It's also, hey, scan this QR code on this flyer real quick. Let's get you signed up for health insurance. It's really important if you don't have it. You want to have health insurance if you're going to be doing this for a hobby, for a sport. A lot of people, when they enter it, I can't remember how many people at my first training at the Ocoee were like, hi, my name is Josh. I've never been whitewater rafting before. And I signed up to be a guide and didn't have health insurance. So they didn't know. So it's really making sure that you're onboarding people from the beginning that they should get signed up for it. Group health insurance. I know there was a few yeses that they already offer it, or that already offer health insurance. I'm not sure if they offer it in a group capacity or not, so that's what the next poll is. Group health coverage is a really great way to get great employees. It's great for retention, it's great for hiring, it's great for employee happiness overall. Being offered benefits is something people want. I know it's often challenging, but many times there are a few full-time staff at larger companies, and they would like benefits. It's a good way to keep them around, to keep the people you like and get better employees along the way as well.
So Carrie, it looks like everyone in this webinar has a full-time year-round staff.
They do. Awesome. So this is a really, you think of your, oh, I have 2 people, I can't offer a group plan. But you can. I can help groups of 2 or more. I mean, the number on the other end is limitless, so I just put 1,000 plus, but you just need 2 people. It's not as expensive as you think compared to continually hiring new employees to just offer benefits and pay a certain percentage of it. There's many different options. I have a very large portfolio of group plans across the United States so that I can customize coverage to fit budget. And I don't ever charge brokerage fees. That's something that can really drive up the price. Monthly is a brokerage fee every month to, answer a question here and there, so I do not charge those. Who should look at group plans? Everyone in this webinar, apparently, those with year-round full-time staff. If you have employees for you that work year-round, it's worth exploring. There's multiple options to buy group health. There is implementing tax credits through ICRA, which is a tax system where you buy coverage off marketplace and receive a tax credit for your business. It's not necessarily the choice for your seasonal employees overall, but if you have full-time staff, that's something that's definitely worth talking about. And then purchasing a private group health plan is a great way to really make an attractive benefit package that you can retain and have a great longevity with your staff. It gives you a competitive edge. People always prefer to work somewhere that offers benefits. Let's be real, is part of it. So that if you have those higher paid salary employees or that make $40,000, $50,000 a year, it's something that really attracts them. And those that already offer group coverage, I would love the opportunity to see if I can save money and improve your coverage. I have been very competitive lately for every group quote I've done overall, just because I have so many different options. I would love to see if we can work something out. I'm really knowledgeable of what people in the industry desire and would love to share it with you. And then this is a big one, I think, for the industry, is the solutions for those that own the business and manage the business, that are higher earners. So I used to make $20,000 a year and live in guide housing. I did. I definitely paid $0 for my health insurance. Loved it. I don't pay $0 for my health insurance anymore, right? It's just the more you earn, the more it costs when you buy on Marketplace. And Marketplace is not the only option for you and your family all the time. So if you're a higher earner that's looked at Marketplace and you don't receive a subsidy, or you receive a very small subsidy, or maybe you are a newer business owner and you get your taxes straight and you haven't filed taxes in a couple of years, which happens, I understand. Here are the other options for you. First is short-term medical. These are 3 of these things I offer. One I don't recommend. But short-term medical is a private insurance plan. It lasts for a specified period of time. So short-term medical insurance will last up to 12 months in most states. Some states have limits that are only 3 months. It just really depends on what state you're in. So short-term medical is generally similarly priced to marketplace, slightly lower based on you and your health and age and smoking status. It's lightly medically underwritten. What does that mean? It means they look at your basic information in the computer systems for insurance world, essentially like your pharmaceutical history and like crazy, did you have a heart attack and things like that. So it's easily approved overall as long as you fill out the application correctly and can save you a little bit of money. I see that most people pay under $1,000, which means you pay between $500 and $1,000. I would love if you just like those that answered in that under $1,000, if you could drop in the chat and just say for how many people that is. I'm curious. I would love that. And then, so short-term medical is a good option. Sometimes you supplement it with fixed benefit plans, or sometimes people just buy fixed benefit plans. So these plans have a specific amount that they'll pay out per occurrence. Let's say you have a heart attack, a plan would pay out $50,000, whatever the plan outlines, but that's all you get, that's it. Or you have a stroke, the plan pays out $25,000. You break a leg, the plan pays out $1,000. You go to the emergency room, it gives you $500. And next is private PPOs. So private PPOs are only for specific people that are extremely healthy and can pass full medical underwriting. They look at everything. There's a full application that asks you all your medical history. But if you're able to pass medical underwriting, it can save you on average 20% on premiums compared to buying a marketplace without a subsidy. And the last is being insured. I love when people pick this one. I'm being sarcastic. I don't. Insurance is a transference of risk. That's pure and simple what it is. If you are self-employed or a high earner, you are your biggest asset. You are your biggest investment. You are what creates you income. If you have a medical emergency, not only are you not able to work, you now have medical debt to deal with. As a business owner, I don't recommend that. That would stress me out awfully. So I would not recommend option 4 of being uninsured. I've seen some really rough things. I recently had a friend have a random medical crisis from taking supplements that cost him $75,000 just from going to the emergency room. So that one's a terrible option, honestly. And then just overall insurance solutions that we offer. Individual health, we can help your employees, we can help you and your family one-on-one. Group health, 2 to infinity. Private health plans, these are for both groups and individuals based on it, how many people. So let's say it's you and a business partner, you could go get private health plans together. Dental, vision, disability, critical illness, accidental insurance and critical illness. I just want to expand upon critical illnesses. I am urgently ill, like I had a heart attack, I'm in the hospital, I had a stroke, things like that. And accidental is I hurt myself. So accidental can cover injury or death, either one. And then life insurance, and then liability for river races. So we all remember when they were talking about canceling all the class 5 events. So Gorefest came back this year, yay. And that was because we were able to get them liability insurance. The Green Race also purchased their insurance through me and Insurance Through Texans together. OB Joyful has used this policy. Multiple people have utilized it for class 5 races and other events as well. So that is available if you ever hear of an event saying that they are canceled because they don't have insurance. The answer is no. And then there's my contact information. I would love to connect with you. You can send me a text. That's the best way to reach me at my business line. You can shoot me an email. You can book a time with me. If you just want to chat with me about how I can help your business or you specifically, you can always book a 30-minute meeting with me, or you can book a health insurance appointment if you just want to talk about that. And I would love if you connected with me on Facebook or on LinkedIn.
Awesome. Carrie, thank you so much for being here. Thank you all for your participation. What questions do you have? Does anyone need help right now or have questions right now? Feel free to turn your mic on and just ask what questions you have.
Quiet crowd.
Yeah, maybe we've got enough information.
Yeah.
Yeah, if we're not, if everybody feels good with the information, um, if we don't have any questions, we can certainly wrap up. You will get a follow-up email that'll have that information for Carrie's contact if you didn't get it today. I also will have the recording for the session posted later. So if there's anything you want to go back through, that will be available as well. And you can certainly spend your extra time checking out the conference agenda and getting registered for Chattanooga too. So we hope to see you all there. Um, if there's nothing else, Carrie, do you have anything else? We'll wrap up.
No, I appreciate everyone joining me. I love serving this industry, and I hope you
Wait.
guys got some good information.
Oh, wait. Jerry has a question. I'm very interested. What has been your experience with what percentage of employees sign on?
If they speak with me, I would say 9 out of 10 sign up for insurance. It's just like we talk, hang up, and they have insurance 9 out of 10 times, I would say overall.
9 out of 10.
Yeah.
Wow. And Jerry says he's got
Yeah.
100 employees. Wow. That would be great to
Jerry,
have
I would love to
90.
speak with you. Yeah, I would love to speak with you and just kind of learn more about your business and maybe can give you some better examples. There's some businesses like NOC in North Carolina has an extremely young employee base. They just do, they're all 19, 20. I necessarily don't help 90% of their staff specifically, but other employers, I help 100% of their staff because they have an older staff base. So it's just really situational on you and your business. We could talk more about it, and I could really just kind of give you my synopsis.
That's great. Great. Yeah, hopefully
Yeah.
you two can connect.
Yeah.
Thank you,
Awesome.
Jerry. Anyone else have questions? Otherwise, Daniel just said wonderful presentation. Thank you. It is
Great.
really great information. It's just such a big need in our industry. Insurance is just so tough, and it's tough enough to keep employees. And when we can care for them and
Yeah.
care for their health, it's really helpful. So much
Well, and it's
gratitude from
not
the
just,
industry.
yeah. Thank you. And it's not just the guides, it's the bus drivers and the restaurant workers and aux workers, all the people that keep it going. They all need health insurance too. And that's really where I've seen it is, all the support staff has access as well. And that's kind of an important thing I like to point out is they should be informed as well.
Great.
Yeah.
Great. Well, thank you.
Awesome.
Oh, Chantal, thank you for the information. I never thought of any of this was possible for our incredible seasonal staff. That's great to hear. I love that we're
Oh, thanks.
bringing this to the table and making those connections because it's such a valuable piece right now.
It really is. And it's just sharing the information and the boss is really someone people trust. The manager is someone they trust. They say, oh, this person told me I can trust and go there, and they're more likely to do it than some random ad on the internet.
Well, we will make sure at America
Yeah.
Outdoors to keep your information
Yeah.
available. If anyone has any questions and doesn't remember or doesn't have the information for Carrie, reach out to me. But yeah, thank you all for your time. We appreciate it, and we hope to get all of these employees insured and cared for. So thanks for being here today.
Thanks so much, guys. I appreciate you joining me, and it was awesome. I really appreciate it.
Thanks, Carrie. Everybody have a good day.